Hi, my name is Julie, and I'm here to share our experience with methyl B12 injections in our son Nicholas. Just to give you a little bit of background, Nicholas was diagnosed with PDD-NOS at the age of 18 months. For him, we knew something was amiss pretty early on, and we were encouraged to get an evaluation from him from a developmental pediatrician. And the news wasn't a big shock to us at the time. And he was very young, and we were starting with traditional therapies, so our outlook was very good. Around that time, or a few months after, I joined a support group of parents through one of our service providers, and basically it's a monthly group that meets. The parents talk about what they've been doing with their children and different therapists, and one of the families in the support group brought up their experience with methyl B12 injections. And at that time, Nicholas was pretty young, and the thought of actually giving my son a shot, twice a week was pretty scary. I'm not good with needles. I'm not a needle type person. My husband is the same way, actually. So, I listened to what they had to say, and I went ahead and did some research on my own. And we started researching other options for treatment. And it probably took me a good 4 or 5 months to actually decide to make an appointment with Dr. Neubrander and see what his opinion would be. So we saw initially Dr. Neubrander in September, and he thought that Nicholas would be a good candidate for the methyl B12 injections. So at that time, I think that was our first journey into biomedical treatments. I remember the first time I gave one of the shots, I was pretty nervous. I was just afraid of hurting him. He's a baby, so I kind of practiced on, I think, my husband once, and after I felt confident enough to do it, I did it, and we actually use the numbing cream, and I do it when he's sleeping, and we've had no problems whatsoever in terms of administering the shot. He doesn't feel it. He doesn't really even wake up. If anything, he'll just maybe move a little bit, but it really hasn't been a problem at all. And I never thought that I would have the confidence to actually give him injections, but now it's kind of like second nature. It's not a big deal. So we were kind of warned of some of the side effects that we might see initially from the injections, and one of the biggest things that stands out for Nicholas is he became very oral. He also has a oral motor apraxia diagnosis as well, along with a PDD. And at that point, when we first started the shots, he wasn't very oral. He really didn't have much babbling, no language. So we were hoping that that was one of the things that would increase. And once we started giving the shots, he became very orally fixated, chewing on things, furniture. His blanket became kind of, it was almost like he was just seeking so much sensory input into his mouth. And it was kind of concerning at first because he was pretty much trying to chew on everything. And, at one point we were just kind of like, this is just really crazy. But along with the chewing came sounds, just babbling, trying to use his language for to request things. We'd had great experience with text, but we were really trying to encourage the verbal language. So that was one of the first things that actually came out as a benefit from the shots. Another thing that we noticed was he started waking up once or twice in the middle of the night. So like I said, disrupted sleep pattern started, and that was kind of tough to take as well because we really hadn't had an issue with that for a while, and then it kind of came back. And then the third thing that we noticed was an increase in hyperactivity. So he'd kind of just run around the apartment. Sometimes, he was a little bit harder to calm down, but those are, I would say, the 3 main things that we noticed in terms of reactions. And at that time when we first started the shots, we didn't add anything else. We didn't tell his therapist, we didn't change therapists, we kept everything stable so we could monitor his progress and how he was doing. Over time, those side effects have gone away. He no longer chews on things, and he's sleeping great. So hyperactivity, it's almost a good hyperactivity. He's really more aware of what's going on. So that's another benefit, I guess. He's more aware. One of the things that we noticed right away was he was almost more calm and focused. Like we had issues with going out to stores where he just couldn't sit for an extended period of time. We would try to go out to dinner or go out as a family for a meal, and he just had a really hard time sitting, and it just wasn't enjoyable for any of us. And that actually has been just a real joy for us, that we can actually take him out places and he isn't getting irritable and upset and crying and wanting to leave and run around. So that's really wonderful. In terms of his expressive language, we've seen a huge jump in expressive language. He's still, because he is apraxic, his words aren't as flowy, I guess you could say, as other children that are beginning to speak, but we actually have words in 2- and 3-word combinations. They might not be distinguishable to people who don't know him, but he's really trying to speak, and it's almost like he's learned the power of language. He has learned that in order to speak and interact with people, I need to use some type of sound production or language production. He also has been learning sign language. We've been using all the typical signs that we tried to teach him for the longest time, but because he does have difficulty with motor planning, he just couldn't get it. He would actually try to take our hands and make the signs for when he wanted something, but now he's actually able to motor plan the signs and do them himself. So it's really encouraging to see that. It's all kind of coming together. He's also always been pretty good in terms of his speech and ABA therapy. Now he's able to focus for longer periods of time. His receptive language has kind of taken on a new level, and he's able actually to generalize a lot of the concepts that he's learned in his therapy outside of the closed door in his room. We're just really pleased with how he's been doing. For us, it wasn't a huge improvement all at once. Every few weeks, it's something new that comes about, and we're really happy with the results that we've seen. It took some time to get over the reactions in the beginning. It's almost like, okay, do we stop this? Can we handle the hyperactivity and the chewing and some of the other things? But we stuck with it, and we've been very happy with what we've seen, and we're just hoping for more and more improvements in the future. So that's our story. Thanks.